Today we will discuss everything you need to know about erysipelas. So, erysipelas is a skin infection. It is a form of cellulitis, but unlike cellulitis, which affects deeper tissue, erysipelas only affects the upper layers of skin. However, the two conditions can overlap, which can make it hard for a doctor to tell the two conditions apart. So, these spots increase and lead to swelling of the skin and raise the temperatures. Previously, the doctors saw that erysipelas only affected the face, but the National Organization for Rare Disorders now estimates that around 80% of all cases occur on the legs. It can also appear on the arms and torso. So, the symptoms of erysipelas can lead to fever and swollen lymph nodes near the affected skin. The patient feels pain all over his body. There are reasons that lead to the emergence of erysipelas. The most important of them, the presence of scratches and burns and bruises, also infection of the affected skin after an insect bite. So, this patient may suffer sometimes from weak immune system like hepatitis, diabetes mellitus, fungal infection between the toes or overweight. There are reasons that lead to the occurrence or reoccurrence of erysipelas. So, as regards the causes of erysipelas, erysipelas mostly develop when the bacteria enter the skin through cuts or sores. Skin injuries that increase the chances of developing erysipelas include cuts to the skin, ulcers or pit sores, insect or animal bites, wounds from surgery, pre-existing skin conditions that break the surface of the skin also increase the chances of getting erysipelas. These conditions include eczema, impetigo, fungal infection. Other conditions can also increase likelihood of a person getting erysipelas. These do not always affect skin directly and include veins and lymphatic vessels not working as they should. So, obesity, alcoholism, poorly controlled diabetes, circulation problems, weak immunity, all these participate in the problem. There are some people who have repeated erysipelas in the same place, such as foot or leg. We advise these people to go to the doctor immediately. Number two, to take strong painkiller to relieve pain. Number three, take antibiotics, capsules or injection such as penicillins and others. So, sometimes erysipelas, there is difficulty to diagnose it. In general, doctor will be able to diagnose erysipelas by the appearance and symptoms of the affected area. This is because the symptoms of erysipelas tend to occur only with this particular condition. The person's medical history, highlighting previous injuries or surgery, will often suggest possible cause. So doctors may carry out blood tests if there are any signs of systemic infections, such as bacteria in the blood, like bacteremia. However, the identification of bacteria is not always possible, even in the laboratory. So we can also make another investigation like CBC. It may show increase in white blood cells. Also sometimes also we make CRP, which is produced by liver in increased amount when inflammation occurs. Also positive blood culture. Sometimes also the presence of a specific infection caused by animal bite, for example. In some cases of deep infection, magnetic resonance, MRI, or CT scan is necessary. So, we advised rest completely, and also we advised improve the immune system by healthy diet and vitamins. Also, we treat the wounds and scratches. But as regards the antibiotic, usually we give antibiotic through intravenous antibiotic in severe cases, and we can give oral antibiotics in mild cases. But as regards the patient who are diabetic, we have to adjust blood sugar level, and also as regard the organ who is affected, keeping the infected area elevated, also still ensuring movement to try and prevent clotting, cooling bags placed on the skin, lotions to stop the skin getting dry and cracking. Also sometimes we give anti-inflammatory painkillers such as Profen. Compression stocking once infection has settled. Treatment for any breaks in the skin, often with prescribed creams that is applied directly. So, what about the prevention? Erysipelas is curable. Signs of fever and illness associated with erysipelas will often disappear within few days of starting treatment. Sometimes we give analgesic. Also, the skin infection can take weeks to clear up. There is no scarring usually. About 1/3 of the cases who receive treatment for erysipelas develop the condition again. When this happens, a long-term course of medication can be prescribed to treat it. It is important that the person sees their doctors as early as possible if they have any concerns about repeat attacks. If other conditions have contributed to the attack, such as eczema or athlete's foot or diabetes, then treating those conditions properly can help prevent further outbreaks of erysipelas. Treating breaks to the skin swiftly can also help. Likewise, if being overweight or having bad circulation contributed to the infection developing, a change in the lifestyle and the diet can often help limit the chances of erysipelas to return. At the same time, try to stimulate his blood circulation. We can give him good healthy diet to improve his resistance to diseases. Thank you very much.